There is no one single test for irritable bowel syndrome. It's a collection of symptoms as defined by their own criteria that must include abdominal pain with either diarrhea or constipation or a combination of the two that you should have had for at least 3 months. If you have any worrying symptoms such as rectal bleeding, weight loss, anemia, or a family history of colorectal cancer or inflammatory bowel disease or celiac disease, you will probably need to have further investigations done. The most common tests doctors perform are blood tests to make sure you're not anemic, and also to check your antibody tests to see if you have celiac disease. Most doctors will also send a stool sample to make sure there's no infection, and then put you forwards for a flexible camera test called a colonoscopy test to look at your large bowel or colon in more detail. To perform this test, you have to clear your bowel out with a laxative in the 24 hours before the test, and then on the day of the test you're normally given sedation to relax you. The test itself can take anything from 20 minutes to an hour to perform, and during this time you may experience a bit of wind and discomfort because air has to be put into your bowel for the colonoscopist to see. If they find any pathological problems such as polyps which look like cherries in the bowel, these will normally be removed during your test. Rarely there can be complications that can occur from colonoscopy, and these can include perforation or putting a hole in the bowel. The risk of this happening varies from one colonoscopist to another, but on average the rate of perforation is normally quoted as 1 in 2,000 to 1 in 3,000. A rare complication is bleeding or reaction to sedation, but to find out more about complications it's important to question your colonoscopist before your procedure.